Welcome to the clickeasy Instructions for Use video. Patients should be thoroughly instructed in the reconstitution procedure. For young children, the reconstitution process should be supervised by an adult. For administration of Sizin 8.8 milligrams contained in the clickeasy device, please listen to the following instructions carefully. Please consult your doctor, nurse, or pharmacist if you have any questions concerning the reconstitution process. The product, powder in vials, must be reconstituted with the enclosed diluent using the clickeasy reconstitution device. The reconstituted solution is intended for subcutaneous administration under the skin and should be clear with no particles. If the solution contains particles, it must not be injected. Before we begin, let's review the components of your clickeasy. We will start at the bottom with the vial containing growth hormone in powder form. This powder can be loose or cake-like. The vial is encased in the outer housing. Next, you have the sterile transfer cannula, which connects the vial and diluent cartridge. The sterile transfer cannula and the diluent cartridge are encased in the main housing. In the middle of the main housing, you will notice two plastic taps, referred to as cartridge grips. The top of the clickeasy is called the end cap. You will note there is a green square. To begin, you will need a clean, dry, flat, non-slippery working space. Next, gather your supplies. You will need your clickeasy Instructions for Use, IFU, and one clickeasy device. Wash your hands with soap and water. Inspect your clickeasy expiration date. You should find it on the Sizin vial in the bottom of the clickeasy. Check the clickeasy for damage or cracks. Do not use the device if the vial or cartridge appear empty or used, and return it to your pharmacist or doctor. Place the clickeasy device vertically on a clean, flat surface, with the Sizin vial on the bottom and the diluent cartridge outer housing cap on top facing upward. Push on the top diluent cartridge outer housing cap firmly until the Sizin vial outer housing is completely inside the main body. This step breaks the tamper-evident seal on the vial. Turn the diluent cartridge outer housing cap clockwise until the green square is visible at the lower end of the narrow rectangular opening. Push the diluent cartridge outer housing cap down very slowly until it will go no further, and the green-colored square appears at the upper end of the narrow rectangular opening. Check that all the diluent has been transferred into the vial. Dissolve the Sizin powder with the diluent by gently swirling the clickeasy device. Note, do not transfer the diluent forcefully or shake the clickeasy device. A fast transfer of the diluent or shaking of the clickeasy device will create foam. Let the solution stand for 2 to 5 minutes until the Sizin powder is completely dissolved. Turn the clickeasy device upside down so the Sizin vial is now on top, and pull the diluent cartridge outer housing cap slowly downwards until the solution is completely drawn back into the cartridge. Check that no more than 1 or 2 drops of solution remain in the vial. If there are more than 1 or 2 drops of solution remaining in the vial, slowly push the diluent cartridge outer housing cap up until some of the solution is back in the vial, and gently tap the clickeasy device. Then, draw the solution slowly again back into the cartridge. Remove any excess air that has been drawn into the cartridge by slowly pushing the cap up until no air bubbles are visible in the cartridge. There should be no air bubble in the cartridge. Note: avoid pulling the cap down too fast, as this will draw air into the cartridge. Turn the clickeasy device so that the cap is again on the top. Unscrew the cap and remove it. Remove the cartridge containing the reconstituted Sizen solution from the clickeasy device by grasping the end of the cartridge and pulling straight out of the outer housing. Carefully peel off the outer white label on the cartridge using the tab provided by slowly pulling in the direction of the black arrow. Write the reconstitution date on the transparent inner label on the cartridge. This cartridge now contains the reconstituted Sizen solution that will be used for your treatment. The cartridge containing the reconstituted Sizen solution is now ready to be used. Sizen must not be used if it is cloudy and should only be used if it is clear and colorless.